My name's Fiona Stubbs. I'm the Careers Manager for the College of Medical, Veterinary and Life Sciences. Before we get started today, I'd just like to go through a few housekeeping items for the session so you know how to participate in today's event. The event is a webinar, so your cameras and microphones will be turned off. It's slightly different from Zoom. If you want to ask our speakers a question, please do so using the Q&A function, which is at the the top right of your screen. A great feature we've got is you can upvote your peers' questions if you think they've got a fantastic question just by kind of voting for it. Please don't use the chat function to ask a question. I know that you're probably familiar with using that for the Zoom. Use the Q&A function, not the chat function, to ask a question. And just so you know, this webinar will be recorded and you'll find a copy of this presentation on the YouTube channel in a few weeks. So before I do anything else, I'm not sure if Sue's around. Sue's been able to get on, but I wanted to introduce you to our speakers. I can see we've got two people here, Hala and Hala. I daren't say their names. I've already excused myself from but by coincidence, they've both got the same names. We're also waiting for Sue Campbell, who is a lecturer here at the University of Glasgow, teaching on public health programs, the global health and the health services management. She also worked for the Royal College of Physicians and Surgeons of Glasgow, running the travel medicine programs, and has got 18 years of work experience in public health in Sub-Saharan Africa. So hopefully we'll get Sue to join us at some point. But by the trick of technology, Sue, we've...
Sorry for being late. Very sorry.
No, good to have you here. So just so you know, I've done the housekeeping. I've introduced Hala and Hala and yourself, and I did a tiny bio on you, and I just wanted to start on the questions. And this is the first questions directed at Hala and Hala, but please chip in at any point, Sue, because you've got a lot to contribute. So why are you studying a master's? And this isn't a plug for Glasgow University. So why are you studying masters? Please start, Hala Marcus, if you'd like.
Hello, everyone. I'm really happy to be here with you all. So I come from a country called Libya, which is residing in the North African Middle East, and we have many conflicts and going through many of the armed conflicts. So the health sector is really suffering from lack of resources, lack of strategic planning, and people there cannot even access to the basic health needs. So that's why one of my aims was to educate myself about how to strategically plan in promoting health programs, and to understand how leadership and management should be in this pluralistic setting. So when I come back to my country, Libya, I would be working on promoting this sector because I usually work with the Ministry of Health. So this is where I would like to put all the learning that I've got from this master's degree.
Great answer. And yourself, Hala?
Hello, thank you everyone for your time and for attending this this talking. About my reason to study Master in Health Services Management, I have a work background in Palestine, my country, and I've experienced a lot of issues inside the healthcare system, which gave me the motivation to participate in leading socio-economic development and sustainable healthcare system in my country. And during my work in different positions in the health sector, I realized that I need to achieve three things through my master: I called it ENC, expertise and managerial skills to develop and to empower my ability for my future goal, and networking networking with my colleagues in the program who already come from different background, and they have different experience. So I learn from their knowledge, which will broaden my perspective. Also, it's regarding my career. Through master degree, I intend to enhance my career profile in the competition in the health industry through having a master degree, graduating from top university, and which all I think will help me to achieve my goal.
Thank you. And over to you, Sue. I mean, you see many students yourself. I mean, all with varying degrees of motivation for doing those two courses. What do you find from the students who are on your courses? Why are they choosing to do it? And also, isn't it true that it's one of the fastest growing masters in the university? Or is that me getting my facts wrong?
Certainly public health is. I suppose that's a reflection on the coronavirus, etc., that public health has got more public awareness, if you like. I mean, I would just say that, you know, Hala and Hala, like, they're two students I would be extremely proud of and have great hope for the future, if you like. But it's absolutely wonderful to see their development, the sort of advancement of critical thinking skills, their interest in supporting health and global health. You know, that they want to do a really good job and realize that they need some extra skills beyond their clinical skills to actually be able to make a difference in a sort of wider context, if you like. So yeah. I'm so proud to see them here.
Oh, that's great. I'm very delighted that they are here. Going on to our next question, and Sue, maybe we could start with yourselves. What experience have you got or had in the global health sector?
Yeah, so I'm a nurse by profession, and I worked in Africa for about 20 years. So 13 years of those were in Uganda. So a lot of it's been working with Ministry of Health, international NGOs, trying to work a little bit at the policy level, trying to influence policy, trying to bring about change, but then recognizing that for me as a visitor to another country, I also have so much to learn. So I've worked a lot on HIV prevention programs, sort of working with local communities, trying to develop their capacity so that they can also access more resources to help them improve the sort of health of their populations. So yeah, no, it's been interesting work, I have to say.
Well, I didn't really know that about you, Sue. Gosh. And Hala, Marcus, can I ask what experience you have had, if any, before you did your master's?
Yes, I've worked in promoting health for more than 6 years back in my country. I studied medicine. I'm graduated from medical school. I worked for maybe 1 year as a clinical doctor, and then I found my passion more into a development side of things, especially with the unique context that Libya has with the displaced people and conflict destroying buildings and destroying the infrastructure of the health sector. It's made me realize that the health sector needs more of an advancement on how to allocate resources with whatever limited resources you have to promote it, rather than just giving services that are unable to meet the demand. So I worked with the USAID, which is the United States Development Office. They have plenty of activities and programs within Libya, one of which is promoting the health sector with the collaboration of the Ministry of Health, along with other humanitarian agencies such as the UNHCR, which is the United Nations of humanitarian response. So basically, these are the sectors that are dealing with whether the crisis and providing it a humanitarian response, or whether for international development and developing certain entities within the country.
Thank you. And Hala, yourself, what experience have you had prior to your master's?
I have a bachelor degree in pharmacy. So I've started working in pharmacy for a few years in public and private sector. Then I moved to humanitarian organizations, national and international non-governmental organizations. Some such as in national organizations, I worked in a UNICEF supervised project, and in international organizations, I've worked for organizations like Doctors Without Borders and Islamic Relief France. My work was in health projects in different tasks, and also in clinical and non-clinical settings. And one of these projects' goals was to promote the health of different segments of societies, including university students, caregivers, and children. Then,
wow.
Then through this work, I developed the curiosity and the interest in management, because I realized that we need a lot of leaders and managers in the health sector.
Okay. Thank you both. You've had a really great experience. You've squashed a lot of experience in a short amount of time. So just to follow on from that, and I know some people in the audience may be thinking of potentially doing a master's in these two areas. I wondered, but you've got Hala and Hala here who have had experience. Do you get students coming directly from the undergraduate onto a master's? Is it necessary for you to have some experience in the sector prior?
I think it's much better to have had some experience. Doesn't need to be in global health, doesn't need to be in public health or in management. But what you want to do when you're studying at master's level is be able to relate, reflect back on something that maybe happened in your working experience and think about, that from a sort of theoretical point of view. So I think to get the most benefit from a master's, to have at least a year's work experience is very useful, because there's a lot of things you can't quite get from a textbook. It's your own experience, which is important.
The context always helps learning. Yes, thank you. So on to my next question, and I often get students asking me what kind of companies they can work for, just so they can start their job search off. So my question would be, what companies, organizations might a student who's interested in global health work for? So you've mentioned NGOs, so it might be different types of organizations and specific ones. So you mentioned, Hala, you went, was it Medicine Without Borders or Doctors Without Borders? So can you just give us a few ideas to get everyone's brains ticking over and to start that job search? So can I ask you, Sue, please, any ideas?
Yeah, if you're based in the UK, there are a number of websites you can access. And I think it is extremely important to do proper research on any organisation that you are interested in working for, to make sure you do have the right values and the right sort of approach, that you join an organisation where you feel your values are aligned. So there's organisations like Relief Web. There's another organisation based in London called Bond, which is a sort of organisation of NGOs. And what they will do is they will advertise jobs that different NGOs or people working in international development, sort of broadly, where they're looking for people to recruit. And you can usually access a full job description, closing day, application procedures, etc. So
Bond as in James Bond?
It is, but it's an acronym. I think it's
okay, right.
Yeah. So it's not 007 himself. Yeah.
But BOND, yeah.
But it is BOND as an acronym. And then a lot of organisations, like some of the bigger organisations, like Oxfam, Hala mentioned MSF, Doctors Without Borders, Save the Children, they also advertise jobs directly on their website. And it can be a good idea, even if you're just sort of thinking about working in global health, you start to look at what kind of skills or experience organizations are looking for, even if you don't think you might be working overseas for a couple of years. And then the other thing is obviously to consider, how can you be involved in global health but you don't need to travel, because there's a lot of sort of advocacy and raising awareness of inequalities, for example, that you can do from home. So, in the medical field, we have organizations like MedAct, or we have Students for Global Health. So there's a lot of other things you can do. Global health doesn't mean you have to go to another country and take part in activities there.
That was a great list to start. Thank you very much, Sue. Hala, Marcus, do you have any suggestions?
Not particularly international organizations, but because I come from a different context, so we use global health knowledge is also useful on a local level, such as on the ministry level, on even on a bottom-up approach from organizations that are advocating for certain awareness, as Sue has mentioned. So I don't know about the UK, but I think also it is an opportunity if you have knowledge in global health and you have a master's degree in such specialty, you will be also able to work in NHS, maybe within the policy side. Maybe Sue would know better in this perspective, but whenever I see a job post, I see that if you have global health knowledge, it is a bonus. For sure.
Thank you. Hala?
Yes, there's a point that I'd like to confirm, just to avoid being restrictions to specific fields, is that the healthcare system is pluralistic, which means that it has different actors and different objectives. So I can say literally wherever you work in the health, you work in the global health sector, because in public sector, you already, most governments has their agreements with other international governments. So through work in the public sector, you already work in the global health sector. Through international NGOs or other NGOs like civic societies or other social campaigns or other projects, you work in global health. Also, you can work in research institutions or centers in health, and in media. If you want to work from home, you can. There is a lot of medical websites that needs medical writers who write about health issues and increase people awareness. We've seen this during the COVID. I think we need a lot of medical professionals who provide information about epidemics and other related stuff.
No, thank you very much. Lots of top tips there. Now, I'm not sure how competitive the job market is in this area. Are there vacancies? Is it competitive? So it'd be good to get your opinions on that. But the follow-through question, the main part of the question was, what can students do to help them prepare to get into the field of global health? And how can they make themselves more marketable? So I combine two questions here. So is it a competitive market? Are they looking for people? And then the follow-through question, which you may be able to ask, is how can we get students or people that wanting to go into that sector, how can they make themselves look more marketable or attractive to future employers? Sue?
I'm trying to remember both questions. Is it competitive? Yes. I think one of the biggest challenges is that a lot of organizations ask for experience, and then it's like, how do you get that experience to kind of start off? I think that's a big challenge. So one thing would be getting as much information as you can. And there's actually quite a lot of free short courses, for example, on FutureLearn or Relief Web that I mentioned. They also advertise courses. Some of them are free. So, you know, sort of gathering as much information as you can about the environment is important. There are some countries where it's probably easier to get a job because they're more insecure. So, you know, less people, you can't travel there maybe with your family, you'd have to go alone, you know, so less people would be willing to go to more insecure environments. And that's something that you would, you know, need to consider. But again, it's, you know, it's also just pulling out those transferable skills. I mean, even at Glasgow University, we have the graduate sort of training with what's
graduate attributes.
Yes, graduate attributes. Thank you. So, you know, taking part in that, it's those, you know, yes, it's your masters and your qualifications, but it's also, you know, your team working, your volunteering, you know, these different sort of things that you can be involved in, and perhaps, you know, getting involved in global health issues from home, you know, again shows your commitment to that working environment.
Thank you. Hello, Marcos.
I totally agree with Sue. But what I think about the most important thing that students who are newly graduate can work on is throughout the years they can volunteer with many organizations like Oxfam, British Red Cross, many organizations that you can volunteer to be exposed on the type of work and to get the sense of how things work in these organizations, especially when dealing with vulnerable populations. The other thing is, as Sue has mentioned, sometimes this job requires you to travel to other locations, to be exposed on other cultures. And this is important to have this sense of knowledge and understanding and reading about other cultures, other crises that are happening within many locations. And we can bring COVID as a really good example that it has shown us that there are no borders between countries. So this is what is important, that to be exposed about studying and reading about what issues are facing certain populations and how to tackle that, and do volunteering and being engaged in such work would help you gain these skills that you need.
Hala, can I just ask you the questions? When you say get involved with people like Oxfam and British Red Cross and volunteer, now the most instant thing that I think of when volunteering is to go and work in a charity shop, of which there are many surrounding most cities in the UK. That I know that's not always the case in other countries. But can you be more specific with the type of work that they might volunteer to do?
It's okay. Even volunteering for a shop is good because it will help you gain the skills of how to deal with people and how to improve your communication skills. So this is fine. Also, to be involved on an administration level, to understand their projects, maybe to advocate for certain, to be involved in their campaigns, in advocating for certain topics that is interested to you. This is very important because as I know from my experience, is good communication skills and understanding your audience is really important, because you're going to deal with different society level, you're going to deal with different people that have been through different stages in their lives. So it is really important to have this social skills that you will be able to gain through any work within these organizations.
Thank you. Hala, do you have anything to add?
I think no. Just one point, that if people are concerned about CV and about the point that if I add a position from outside the health sector will impact my CV negatively, in some cases it's not, because many employers took that a comprehensive overview of your CV. So as Hala said, through working in shop, you can improve your communication skills. through other work, you can you can developing your networking skills and communication skills. So it helps you to develop your abilities. But maybe I can talk about the tools that people need to market for themselves, like using professional social media like LinkedIn. And the university already provide some valuable workshops about using LinkedIn to find a career, and also improving their CV and cover letter, because to advertise themselves, and also by networking with many people in events, in college, in work, and even in the street. Networking helps I think it helps to find a job in through LinkedIn. It's a fact. You can just Google it and find that there is a million of employers who look for people to work in their companies, and that there are millions of people who find jobs through LinkedIn and get offer through LinkedIn. That's it. Thank you.
No, you've done my job for me. Thank you very much. Yes, no, I believer in any work experience, paid or unpaid, sector related or not sector related, is really valuable on your CV because of all the stuff you just said. So thank you very much. And I love LinkedIn. We do run masterclasses from the career service, just a little plug there. If you want to join on a plethora of different subjects, so check out our website. I'm going to ask the last question now, and then I'm going to encourage people to think of questions for our three guests today. But my last question, if you could put them in the Q&A function, that would be great. So my question to you is, what would you see as the challenges working in global health? What do you think are the challenges working in global health now or potentially in the future? Sue?
I think one challenge is a lot of funding for global health is quite short term. But you want to, you can't change things in 6 months, even in 1 year. You kind of have to be willing to try and give a longer term commitment. So one issue is definitely around funding for projects. There's a huge need, but there isn't always the money behind it. I suppose that would be one thing. I think coming back to what, Hala has said also about the networking and to try and not have, and this might relate to the funding, to have less of the competition and much more of collaboration between organizations, because we've all got the same goals, but trying to work much more collaboratively. So I think that would be 2 points from me.
Thank you. Hello, Marcus. Have you got anything? Forgive me for calling your full name, but it's just a way, a means of distinguishing you.
You can even use Marcus alone. It's fine. For me, I think one of the greatest challenges is when dealing with governments in the developing world. It is really difficult, especially because our funding, I'm just going to speak about the context that I come from. So our funding mainly comes from developed world and through the United Nations agencies. So basically, as you know, that these require plenty of administration work, and they have many rules, and they need to have a certain standard. When truly implementing these projects on the ground, in Libya, for example, it's really difficult because we face many challenges and obstacles that sometimes we have to divert the direction of our projects, or even the outcome or the objective of our projects, because of the difficulty of dealing with the government from the Libyan side, because they don't understand these really procedures that we as the international community look for. So this is where our role as Libyan and as local employees come to pivot these challenges, because we are the frontline employee there, workers, and we deal with such challenges. So this is one of the biggest challenges. The other thing is, as Sue has mentioned, the time frame. and the budget. Sometimes you have the budget, but you don't have the time frame because of many things that has erupted. Maybe a conflict erupted, maybe a road was closed, maybe people were displaced all of a sudden. So all of these challenges come and disrupt the time frame of your project. That's why one of the most important things that I give you guys as an advice, to be flexible and to think outside the box. You need to have this flexibility of how to tackle this, how to navigate this issue with preserving your objectives of the activity or the project.
Thank you. Great tip. Hala?
I'd like to add to what Sue and Hala have mentioned. There are also other challenges, like depends on the work environment and context, like safety. For example, working in international NGOs isn't always safe because sometimes you need to work in the field, in conflict zone. Also, you can work for organizations that, generally for organizations that have poor hygiene quality or protocols, so it may be unsafe. Another challenge is work overload, because in some locations there are medical staff shortage, so you may have overload in your work. And lastly, the personal development, because we live in the technology era, so things are evolving fast, and sometimes you need to acquire technological skills. You see, because of artificial intelligence and Internet of Things, many tasks are automated, from the work of surgeons, like robotic arms, to the work of people in administrative tasks, like working using internet and MS programs and other stuff. Yeah.
Great. I mean, what a brilliant set of tips there. Still sounds a super cool area to go into, and I can see why there's this rise in interest in it. Can I ask the audience if you've got any questions? This is your time to pick the brains of these three experts here, so please make the most of it. Have we got any questions? I can't.
There.
Yes, thank you. So Hazel, thank you, Hazel. Is it possible to go into the NGO global health work with a neuroscience degree? I know there is a lot of work with infectious diseases, but I would like to work with mental health. Is this possible? And how would you recommend this conversion as a follow-on from Hazel?
I mean, I'll start, but anyone else can chip in. Yes, I think. I mean, again, it's looking at those transferable skills. So you might be highly organized and be able to do some sort of project management, for example. So project manage a mental health project. There are also like short courses that can happen, like psychological first aid courses, for example, which are, that's one area that trying to roll out in different countries. So that's something you could get involved in. So yes, anything is possible. It's just, again, just trying to build up this whole portfolio to sort of understand what role you could play. I don't know if Hala have anything to add to that.
Yes, actually, mental health plays a critical role in conflict-affected setting in general. And in the Middle East and North African region, and the Sub-Saharan Africa for sure. So we have many budgets that are dedicated to do mental health awareness campaigns and to deliver mental health treatment to victims from war, or even civilians who got affected by traumatized, and to treat them for post-traumatic stress disorder and things like that. So definitely you can work. And I just want to emphasize on something, because maybe there is some misunderstanding that global health, yes, it is something that is about the health promotion, but any specialty can work, because there is the operation sector, the finance. In any organization, you can find finance, you can find. So whenever you are passionate about this sector in particular, you can work with any degree. especially if you have the passion for it. So don't feel like there is something that's holding you off with pursuing your dream in global health.
Thank you. Hala, have you got anything to add to that?
I'd like to emphasize on what Sue and Hala have mentioned, and if people don't want to be in conflict zones, they can work in their countries through many health projects, because mental health is a critical part of our overall health. So they will find, the opportunity.
Good. So we're into our last 4 minutes of our talk, and I can see there's 2 questions. So can our panelists ask them as succinctly as possible so we can cover them? So Austin says, is there any way you would recommend for first years to begin preparing to work in global health? Now, we have mentioned about getting experience volunteering, working potentially within those companies, charity shops and so on. Is there any other top tips we can give to Austin and the audience?
Yeah, I think look at the university societies. I think there's one, Students for Global Health. And as I say, think about doing some of the free courses when you have time, maybe in the holidays, like on FutureLearn or Coursera or something like that.
Yeah, I think there's also LinkedIn Learning have a lot of good courses. I couldn't tell you if you've got any in global health, but they've got a plethora of courses that cover virtually every subject in the world. So I think there's a FutureLearn, Coursera, and try LinkedIn Learning for extra courses. That's a really good tip. Anything else from any of the top tips for Austin? Okay, Alisa says, are there any good opportunities for pharmacologists? As it's a career field we don't hear much about.
Hello.
I'm a pharmacist, and I find many opportunities in the health sector, especially in international organizations. You can find many opportunities other than the traditional way for pharmacists. You can work as health promoter and in administrative roles, because you already have a medical experience and knowledge that qualifies you to contribute in many positions and roles. So now you hear about it.
Thank you. So our last question. So thank you for those ones that have put them in the Q&A. From Mukund, what will be the entry-level job in the NHS in healthcare management? I'm not sure if that's a question you can answer. What's the entry-level job in the NHS for this healthcare management?
I'll try and answer. There are numerous jobs in the NHS, so it's just looking at the kind of job applications that come up and seeing what experience they're looking for. In the NHS, lots of the same job might even have different titles.
Yeah.
So you might have like service manager, but when you have a master's degree, you can also put that with your undergraduate degree, depending where that was. So it's not just your master's degree sitting on its own. There's your other experience as well that comes into any application. Thank you.
I'm going to end it now. Can I just recommend that you come check out the rest of the science fair? Following us at 11, there's a panel from people coming from pharmacology companies, and then we've got 2 NHS graduate programs, a management program, and the scientist training program. We've got a sports science, a big break from someone from World Wildlife Foundation, and then Thermo Fisher, a company. Can I also recommend that you go to our careers fair, where we've got the classic exhibition stands from companies, and that's starting at 11 today, so shortly. But can I just end today by thanking Sue, Hala, and Hala for your time, your thoughts, and your expertise. We've really appreciated it, and I think you've kicked off the science fair this year really well. So a big thanks from me.
Thank you.